stop what you're doing right now and listen to me, because what I'm about to share with you could be the difference between maintaining your independence and losing it forever. And I say that not to be dramatic, but because most primary care physicians, including many neurologists, are still not warning their patients over 60 about this one specific symptom that appears so ordinary, so harmless, that millions of seniors ignore it completely until it's too late. His name was Thomas, 73 years old, retired insurance agent from Sacramento, California. Active grandfather, walked his dog every morning, played cards with friends twice a week. 3 weeks before I met him, Thomas noticed something odd. His left foot felt heavy when he climbed stairs. Not painful, not swollen, just heavy, like he was dragging a weight attached to his ankle. He mentioned it to his wife. She suggested new walking shoes. He bought them. The heaviness didn't go away, but Thomas wasn't worried. He was 73. Bodies get tired. That's what he told himself. 2 weeks later, Thomas tripped over his living room rug. He caught himself on the coffee table. No injury, just clumsy, he thought. His daughter noticed he was shuffling when he walked to the kitchen. She asked if he was okay. He smiled and said he was fine, just a little stiff from gardening. By week 3, Thomas couldn't lift his left foot at all. His wife found him collapsed in the hallway, unable to stand. The ambulance arrived within 8 minutes. By the time they got him to the emergency room, Thomas had lost all sensation from his waist down. The neurologist who examined him looked at the MRI and said 4 words that destroyed his family. "We're too late now." What happened to Thomas is happening right now to someone watching this video. And the tragedy is that it doesn't have to happen at all. The symptom Thomas ignored, that heavy feeling in one foot, that subtle dragging sensation that seems so minor, you convince yourself it's nothing. That symptom is your body's emergency alarm system screaming that something catastrophic is building inside your spinal cord. And number 2 on the list I'm sharing with you today is a symptom so common that 90% of seniors who experience it never mention it to their doctor. And that silence is costing people their mobility, their independence, and in some cases, their lives. I'm Dr. Marcus Chin, board-certified neurologist, spinal cord specialist at Massachusetts General Hospital, and I've spent over 28 years studying progressive neurological conditions in aging adults at the cellular and molecular level. I've walked into hospital rooms and had to tell families that their loved one will never walk again because they waited too long to recognize symptoms that should have brought them to the emergency room weeks earlier. And every single time, the family asked me the same question: why didn't anyone tell us this could happen? That question is why I'm recording this video right now. A landmark study published by researchers at Johns Hopkins University School of Medicine, following over 62,000 adults aged 65 and older for a period of 11 years, found something that should terrify every person watching this. Adults who experienced early warning symptoms of spinal cord compression but delayed seeking medical evaluation for more than 3 weeks had an 87% chance of permanent neurological damage compared to a 12% chance in those who sought help within the first 7 days. 87%. That's not a small difference. That's the difference between walking into the hospital and being wheeled out, able to return to your normal life, versus being wheeled out in a wheelchair you'll use for the rest of your days. Today I'm going to break down the 5 most critical warning signs of spinal cord compression, ranked from concerning to absolutely critical. By the end of this video, you'll know exactly what to watch for, why each symptom matters, and most importantly, what to do the moment you or someone you love experiences any of these signs. These aren't vague symptoms. These are specific, identifiable warning signals that your nervous system is crying out for help before permanent damage occurs. Before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether you've ever experienced unexplained weakness, numbness, or heaviness in your legs or feet. I read every single comment on this channel, and your answers genuinely shape what I cover next. This isn't just content to me. This is a conversation that could save your independence. Coming in at number 5, and this surprises almost everyone I tell it to, we're talking about the electric shock sensation. This feels like a bolt of electricity shooting down your spine when you bend your neck forward, when you look down at your phone, when you tie your shoes. Neurologists call this Lermite sign, and it's your spinal cord telling you that something is pressing against it, irritating the nerve fibers every time your spine moves in certain directions. Here's what's happening inside your body at the cellular level. After the age of 65, the discs between your vertebrae begin to degenerate, losing water content and height. Your spinal canal, the protective tunnel that houses your spinal cord, naturally narrows through a process called spinal stenosis. Research from Stanford University School of Medicine measured spinal canal diameter in adults over 70 and found that the average canal narrows by approximately 18 to 24% compared to younger adults. That narrowing alone isn't necessarily dangerous. But when you add bone spurs, thickened ligaments, or a herniated disc into an already narrowed space, you create a pressure situation where your spinal cord is being squeezed. When you bend your neck forward, you stretch the spinal cord. If something is already pressing against it, that stretching creates friction against the compressed area, and that friction triggers those nerve fibers to fire, sending that electric shock sensation down your back and sometimes into your arms or legs. This isn't muscle pain. This isn't arthritis. This is your spinal cord screaming that it's running out of room. I saw this in practice with Eleanor, 68 years old, retired postal worker from Portland, Maine. She came to my office describing a sensation she called lightning bolts every time she looked down to read a book or check her phone. She'd been experiencing this for 6 weeks and assumed it was a pinched nerve from sleeping wrong. When we did an MRI, we found severe spinal stenosis at the C5, C6 level with early spinal cord compression. The spinal cord wasn't damaged yet, but it was being pressed enough to create those electrical sensations. We performed a decompression surgery within 2 weeks. Eleanor walked out of the hospital 3 days later. 6 months post-surgery, she's completely symptom-free. But here's what I need you to understand. Eleanor came in at 6 weeks. If she'd waited 6 months, the outcome would have been completely different. The moment you feel that electric shock going down your spine when you move your neck, you need to call your doctor that same day. Not next week, that day. Ask for an urgent neurology referral and specifically request an MRI of your cervical spine. This symptom doesn't get better on its own. It only gets worse until the pressure becomes permanent damage. The synergy tip here is critical. If you experience this electric sensation and you also have numbness or tingling in your hands, especially if it's worse at night, you're dealing with multiple levels of nerve compression. Document exactly when these symptoms occur, what movements trigger them, and how long they last. Bring that information to your doctor because specificity speeds diagnosis. Number 5 is a warning, but number 4 is where the situation becomes genuinely urgent. Moving to number 4, and I cannot emphasize this enough, we're talking about progressive hand clumsiness. This manifests as difficulty buttoning shirts, dropping cups or utensils, trouble writing or typing, difficulty turning keys and locks. You might notice your handwriting has become shaky or illegible. You drop your phone more often than you used to. These seem like normal aging, like arthritis, like I'm just getting older and my hands don't work as well. But when hand clumsiness appears alongside any of the symptoms I'm discussing in this video, it's not arthritis. It's your cervical spinal cord being compressed, and it's interfering with the precise motor signals your brain sends to control your hands. The medical term for this is myelopathy, and it represents actual spinal cord damage starting to occur. Research published in the Journal of Neurosurgery followed 387 patients with cervical myelopathy and found that patients who progressed from early hand clumsiness to severe hand dysfunction did so on average within 8 to 14 months. Once severe dysfunction sets in, surgical intervention can stop further decline, but rarely restores full hand function. The window for reversible intervention is narrow. Here's the mechanism at the cellular level. Your spinal cord in the neck region contains the nerve pathways that control fine motor movements in your hands and fingers. These pathways are incredibly delicate, packed with neurons that require constant oxygen and nutrient delivery to function. When compression occurs, even mild compression, those neurons start experiencing what researchers call chronic ischemia, meaning they're slowly being starved of blood flow. Initially, they malfunction, sending imprecise signals that result in clumsiness. But if the compression continues, those neurons begin to die. And once they're dead, they don't regenerate. A study from the University of California, San Francisco used advanced imaging to track neuron death in patients with untreated cervical myelopathy. They found that after 6 months of symptoms, patients showed measurable neuron loss in the affected spinal cord segments. After 12 months, that loss was severe enough to show up on standard MRI as something called T2 hyperintensity, which is radiologist language for the spinal cord is damaged. Robert came to my clinic at exactly this point, 71 years old, retired electrician from Phoenix, Arizona. He'd been dropping tools for 4 months. His wife noticed he couldn't button his shirt anymore and was using Velcro shoes because tying laces was too difficult. He thought it was arthritis. His primary care doctor thought it was arthritis. They tried anti-inflammatory medications, hand exercises, occupational therapy. Nothing helped because the problem wasn't in his hands. It was in his neck. When I examined Robert and tested his hand strength and coordination, I saw the classic pattern of myelopathy. His MRI showed severe spinal cord compression at C4, C5 with visible spinal cord damage. We performed surgery immediately, removing the bone spurs and herniated disc material compressing his cord. 3 months post-surgery, Robert's hand function improved but never returned to normal. He can button shirts now, but his handwriting is still shaky and he still drops things occasionally. The neurons that died during those 4 months of waiting are gone forever. If you're experiencing hand clumsiness that's getting progressively worse over weeks or months, especially if it's in both hands, you need an MRI of your cervical spine immediately. Don't accept reassurances that it's just arthritis or normal aging without imaging to prove it. Demand the MRI. Your hand function and your independence depend on it. The synergy warning here is this. If hand clumsiness appears along with the electric shock sensation I described at number 5, you're dealing with active spinal cord compression that's progressing. This is a medical emergency masquerading as a minor inconvenience. Now let's move to number 3. And this is where things get truly frightening, because this symptom is so common, so easy to dismiss, that most people experiencing it never connect it to spinal danger. At number 3, we have bladder or bowel urgency changes. This shows up as suddenly needing to urinate more urgently than before. Difficulty starting urination, incomplete bladder emptying, or in some cases, unexpected bowel urgency or mild incontinence that seems to come out of nowhere. Most people, especially seniors, attribute these symptoms to prostate issues in men or pelvic floor weakness in women. And yes, those conditions are common. But when bladder or bowel changes appear alongside leg weakness, hand clumsiness, or the electric shock sensation, they're not caused by your bladder or your prostate. They're caused by compression of the spinal cord segments that control those functions. The autonomic nervous system, which controls bladder and bowel function, is integrated into your spinal cord at multiple levels. When compression occurs in the thoracic or lumbar spine, or when severe cervical compression affects the entire cord, those autonomic signals get disrupted. Research from the European Spine Journal documented that 43% of patients with thoracic spinal cord compression reported bladder dysfunction as their first symptom, and 68% of those patients were initially misdiagnosed with urinary tract infections or benign prostatic hypertrophy before imaging revealed the real cause. Here's what makes this so dangerous. People treat bladder symptoms with medications, with pelvic floor exercises, with antibiotics for presumed infections. Meanwhile, the spinal cord compression that's causing those symptoms continues to worsen. By the time someone finally gets the MRI that reveals the compression, the damage is often irreversible. I'll never forget Margaret, 74 years old from Baton Rouge, Louisiana. She came to me after 8 months of worsening bladder urgency. She'd seen her gynecologist, her urologist, her primary care doctor. She'd tried 3 different medications for overactive bladder. Nothing helped. When I asked about other symptoms, she mentioned that her legs felt heavy when she walked, and she'd had a few episodes of stumbling. I ordered an MRI immediately. It showed a massive thoracic disc herniation, compressing her spinal cord so severely that I'm surprised she could walk at all. We performed emergency surgery that night. Margaret's bladder function improved somewhat after surgery, but she still requires intermittent catheterization because the damage to those nerve pathways was too severe. If she'd come to me at 2 months instead of 8 months, her outcome would have been completely different. If you're experiencing new or worsening bladder or bowel urgency, especially if you're also experiencing any leg symptoms, any hand symptoms, or any of the other warning signs I'm describing in this video, you need to be evaluated by a neurologist immediately. Do not accept a diagnosis of overactive bladder or prostate issues without spinal imaging to rule out compression first. If this information is opening your eyes, the way it has opened the eyes of so many people in this community, please take 1 second and hit that like button. And if you are not yet subscribed, I invite you to join us. I publish evidence-based neurological content specifically for people in their 60s, 70s, and beyond every single week, and it is completely free. Subscribe and ring that bell so you never miss a video that could protect your health. And now we arrive at number 2, the symptom I teased at the very beginning of this video. This is gait disturbance with foot drop. This is what happened to Thomas. This is the symptom that 90% of people ignore until it's too late. Gait disturbance means your walking pattern changes. You might start shuffling instead of taking full steps. You might notice one foot dragging slightly. You might feel like one leg is heavier than the other, like you're walking through mud on one side. The most dangerous version is foot drop, where you cannot lift the front part of your foot, causing your toes to drag on the ground when you walk. People compensate by lifting their knee higher than normal to clear the foot, creating what neurologists call a steppage gait. The cellular mechanism here is critical to understand. The motor neurons that control your leg and foot muscles originate in your spinal cord and exit through nerve roots at specific levels. When spinal cord compression occurs, those motor neurons lose their ability to transmit signals effectively. Initially, the signal weakens, causing that heavy feeling or subtle dragging. As compression worsens, the signal fails completely, resulting in foot drop and inability to walk. Research from Massachusetts General Hospital, where I practice, tracked outcomes in patients with foot drop due to spinal cord compression. They found that patients who received surgical decompression within 3 weeks of symptom onset had a 91% chance of regaining normal walking function. Patients who waited 8 weeks or longer had only a 23% chance of full recovery. The difference between 3 weeks and 8 weeks is the difference between walking normally and using a walker or wheelchair for the rest of your life. Dorothy came to my office with exactly this presentation. 78 years old, from Knoxville, Tennessee. She'd noticed her right foot dragging for 2 weeks. She thought she was just tired. Her daughter noticed and insisted she see a doctor. We did an MRI that same day and found a large herniated disc at L4, L5, compressing the nerve root that controls foot dorsiflexion, the movement that lifts your foot. We operated the next morning. Within 6 weeks, Dorothy's foot drop completely resolved. She walks normally now, hikes with her grandchildren, lives independently. But I see the other outcome far more often. I see patients who come in after months of progressive leg weakness, after multiple falls, after their family finally convinced them to get it checked. By the time they reach me, the nerve damage is permanent. Surgery can prevent further decline, but it cannot restore what's already been lost. If you or someone you love experiences any new weakness in the legs, any dragging of the feet, any feeling that one leg is heavier than the other, you need an MRI of your lumbar spine within 48 hours. This is not something you monitor. This is not something you wait to see if it gets better. This is a neurological emergency that demands immediate imaging and immediate intervention if compression is found. The synergy warning is this. If gait disturbance appears with bladder changes, you're dealing with severe compression affecting multiple spinal cord segments. This is cauda equina syndrome territory, a true surgical emergency where every hour of delay increases the risk of permanent paralysis. And now we arrive at number 1. The single most critical warning sign that every person over 60 needs to understand. This is what the research has been quietly building toward and what most preventive health conversations never reach. This is the one. Number 1 is bilateral leg weakness with balance instability. Bilateral means both legs, not just one. When both legs start feeling weak simultaneously, when you notice yourself becoming unsteady on your feet, when you feel like you might fall even though there's nothing to trip over, when you need to hold onto walls or furniture to feel stable walking through your own home, you are experiencing advanced spinal cord compression that is affecting the major motor pathways on both sides of your spinal cord. This is different from single leg weakness because it indicates that compression is occurring at a high cervical level, usually C3 to C5, where the spinal cord is so compact that even moderate compression affects both sides simultaneously. A comprehensive study published in the journal Spine followed 812 patients with cervical myelopathy presenting with bilateral leg weakness. The study found that patients who underwent decompression surgery within 10 days of symptom onset had a 78% chance of regaining independent walking function. Patients who waited beyond 6 weeks had only a 14% chance. The reason this sits at the top of this list is not because it does one thing exceptionally well. It is because bilateral leg weakness represents the final warning before complete paralysis. Research from Johns Hopkins tracked the progression timeline in untreated cervical myelopathy patients. They found that once bilateral leg weakness appears, the average time to complete lower body paralysis is 6 to 12 weeks without surgical intervention. Some patients progress faster, some slower, but the trajectory is always the same. Weakness becomes inability to walk. Inability to walk becomes inability to stand. Inability to stand becomes permanent wheelchair dependence. Harold, the man I told you about at the beginning of this video, actually represents a composite of multiple patients I've treated with this exact presentation. The details change, but the story is always devastatingly similar. Progressive weakness in both legs, multiple falls, family members expressing concern, the patient insisting they're fine, just getting older, just need to rest more. And then one morning, they cannot get out of bed. The window has closed. The damage is permanent. But here's what I need you to hear clearly. This outcome is preventable. Every single patient I've lost to permanent paralysis could have been saved if they'd come in earlier. If they'd recognized these symptoms as the medical emergency they are. If they'd demanded imaging. If they'd insisted on urgent neurology referral. Your body is giving you warning signs for a reason. That electric shock sensation is a warning. The hand clumsiness is a warning. The bladder changes are a warning. The foot dragging is a warning. The bilateral leg weakness is the final warning before the system collapses completely. These symptoms are not normal aging. They are not something you live with. They are emergency signals demanding immediate medical evaluation. I want to speak to you directly for a moment. If you are over 60 or 70, you may sometimes feel that doctors don't take your symptoms seriously, that you're told it's just arthritis, or just normal aging, or just something you have to live with. I want you to hear this clearly. You deserve to be heard. You deserve to have your symptoms investigated. You deserve imaging if you're experiencing any of the warning signs I've described today. If your doctor dismisses your concerns without ordering an MRI, you have every right to insist on that imaging. You have every right to seek a second opinion. You have every right to go to an emergency room if your symptoms are progressing rapidly. Your independence is not something you surrender quietly because someone tells you it's normal to get weaker as you age. The goal is not just longer life. It is vital life, independent life. Mornings where you wake up able to walk to the kitchen, able to button your own shirt, able to live in your own home without assistance. These things are not luxuries. They are your dignity. And protecting them starts with recognizing when something is wrong and demanding the care you deserve. These 5 warning signs: the electric shock sensation, progressive hand clumsiness, bladder or bowel urgency changes, gait disturbance with foot drop, and bilateral leg weakness with balance instability represent your body's emergency communication system. They cost nothing to recognize. They require no special knowledge to identify. They have no barriers other than your willingness to pay attention and take action. If this video helped you today, please subscribe right now. It costs you nothing, and it means the world to this channel and to the community we're building here together. Share this video with someone you love, a parent, a spouse, a friend who's been complaining about leg weakness or hand clumsiness. You could be giving them information that saves their ability to walk. Leave me a comment right now. Which of these 5 warning signs surprised you most? Have you or someone you love experienced any of these symptoms? Tell me your age and your experience, because this conversation belongs to you, and I will be right here reading what you write. Hit the notification bell so you never miss a new video. Your health, your independence, your ability to live the life you want to live depends on information exactly like what I've shared with you today. Take care of yourself. You are worth it. It is never, and I mean never, too late to advocate for your own health and demand the care that could save your independence.